Welcome everyone, and thank you for attending this Lunch and Learn organised in collaboration between the Knowledge and Library Services at NCIC and Boost, the North East and North Cumbria Learning and Improvement Community. My name is Ashley Eaton and I'm from Boost, and today we are joined by Christianne Ormston, who is the Primary Care Programme Lead at the North East and North Cumbria Integrated Care Board. And Christianne is going to be presenting the work they have done on the Primary Care Access Recovery Plan, working to improve patient experience in accessing primary care. Next slide, please, Christianne. So these lunch and learns are designed to be a relaxed and informal space for health and social care staff to come together, share their learning and share their experiences. Next slide, please, Christianne. So before we kick off, just some very quick protocols. If you could switch off your webcams off during the session, that would be great. If you could mute when not speaking. Please feel free to post any questions that you have in the chat, and we'll make sure we have time for some questions at the end as well. Please listen with respect and be present. Please pass on, share the learning, spread the word about these sessions, and please be aware that we are recording today's session. I will now hand over to Christianne.
Oh, thanks so much, Ashley. And thanks to everyone who's come along today. I know it must have been a bit of a lull with the lovely day that's happening outside, but I really appreciate you spending your time listening to this session. So today I'm going to be talking about Primary Care Access Recovery Plan, which is known as PCARP, and I'll refer to that as we go on. And the main focus, though, of today is about working to improve patient experience in accessing primary care. And I know all of us, whilst we're healthcare professionals, we're also patients, and we'll all need to access primary care as we need it. So I'm really interested in your experience and the experience of, your family members or any patients or patient groups that you may work with. And, in terms of primary care access, this has been an ongoing issue. So the Primary Care Access Recovery Plan was introduced in May 2023 as part of a recovery for primary care from COVID. And after COVID, and to meet the increased demands on the service following COVID. But there's always been issues with primary care access in terms of, from my background, is in patient experience and public involvement. Back in 2014, when I first started Newcastle West CCG, I used to run the Newcastle West Patient Forum, and there would be always patients coming up to me to tell me, about the problems they'd had accessing, their practice, that they would ring up and they would get an engaged tone, or, that they would try get through to the practice, but then be told there was no appointments left that day because those practices were following a process of releasing the appointments on a daily basis. And broader than that, I would hear about issues for several ethnic minoritized communities in access and primary care, or deaf communities. And we also know that nationally, following COVID and, while the primary care access recovery plan's been in place, we've had national reports such as the Darcy report that have talked about how, patient experience needs to improve, and that, whilst there's been lots of improvements, things still need to go further to improve. And we recognise there's huge pressures on general practice, there's increasing list sizes, and this has been accompanied by patient expectations. We live in a 24/7 society now where, members of the public can access whatever they want or buy whatever they want through Amazon, with one click. And this attitude and expectation follows on through to other services, and they expect similar levels of service. So it's all of that in the mix. So with no further ado, I'm going to give a very brief whistle-stop tour through the PCARP aims. So when this was introduced, there was 4 national PCARP ambitions: empowering patients, modern general practice access, building capacity, and cutting bureaucracy. And within that, we the primary care transformation team have been working across the Nenk-wide area, looking to tackle the ATM rush, reducing the number of people that are struggling to access their practice, ensure that patients know on the day when they contact their practice how their request will be managed, supporting patients to make informed decisions about the treatment, and make the decisions that are right for them and based on their needs and the level of urgency, and implementing digital tools to support patients to manage access to services, and that's your e-consults and the NHS app. So the first of those aims was about empowering patients, and this is about providing a range of options to support patient choice in the management of their health. So you've got self-referrals, and then there's been work to improve access for patients through self-referrals, and now there's 42 self-referral pathways for 24-25. There's Pharmacy First, which was launched in January 2024, and this is about access to prescription medication directly from pharmacy, and that's for 7 common conditions, and that's sinusitis, sore throats, earache, infected insect bites, impetigo, shingles, and UTIs, and 99% of NENC pharmacies are registered to deliver this, so this is something that we're really hot on as a region. And of course, we talked about the NHS app, which I think many of you are familiar with. And this allows patients across access to a range of services, such as booking appointments, ordering repeat prescriptions, accessing their GP record, and receiving messages from their practice. So, with all that in mind, and the work of the transformation team, what have been the modern general practice benefits to date? Well, a range of support, transformation and improvement funding has been made available to general practice to support the implementation of PCARP. And this has included care navigation training. So this is about training admin staff, receptionists to support that care navigation process. It's a general practice improvement program, otherwise known as GPIP, which you may have heard of. And that's very much about supporting digital solutions. That links in with the better digital telephony, and this is very much about ensuring patient callback functionality. It's about ensuring that, lowering the numbers of calls that are dropped off, improving digital telephony capabilities, giving patients the number and the queue so they know how long they've got to wait. Patients can also review the telephony data, so that adds to quality improvement and they can manage that better. It's about simpler online requests. So, this is your e-consults available for patients so they can make requests through that online. It's about faster care navigation, assessment, response. So this is about the consistent approach. So no matter what route the patients contact the practice, whether it's in person, through the telephone or through an e-consult or the NHS app, that those requests are treated with the same approach, given, with the putting mind to what the patient needs and the urgency of the request. And also so patients know on the day how the request will be managed. So just briefly to go through some of the digital improvements, and this is sort of the work that the digital team have been doing, working with the transformation team, and it's about the increase in patients using online consultation and NHS app. It's about supporting practices and looking at dedicated digital champions to support patients register for the app, transformation lead delivering patient groups with Age UK, providing digital app training. It's about increased access via digital communication, self-booking for patients, and signposting for the correct clinician and service to ensure patients see the right person for the care that they need in the right time. In terms of building capacity as part of the transformation, this is about developing general practice capacity across their workforce teams. So you may have heard about the additional roles reimbursement scheme or the R's roles, and this is about funding practices or releasing some funding so practices can employ different roles across a range of healthcare professionals. So it might be a social prescriber, it might be a physiotherapist or a pharmacist, and it just means that that practice can develop its own capacity and boost its workforce to provide a range of services for those patients for their, on their patient lists. And of course, building capacity is also about estates. So there's been a lot of work to support the development of estates, undertaking general practice surveys, identifying opportunities and the priority of premises developments. And across this time, there's been 12 new clinical rooms complete, which will mean 82,500 more appointments per year. And 17 lease negotiations have also been supported. So a lot of work's been undertaken there. And finally, this is about cutting bureaucracy. So this was the other aim. And this is very much about working with primary care and secondary care to improve communication, review pathways, but also reduce the administrative burden on primary care. So this is very much about looking at the primary secondary care interface, but working with secondary care to reduce the inappropriate requests on primary care. So there's an NHS England network that's there to support this and deliver best practice. And it's very much about educating secondary care to understand what they can request of primary care and when that's appropriate. So there's a lot of work that's been undertaken then. So with all that in mind, and I realise that's been a very whistle-stop tour, happy to take more detailed questions at the end. But the thing that I wanted to focus on today is about the patient experience of accessing primary care. So we know all that work's been undertaken, but last year the primary care transformation team wanted to know what was the actual picture in terms of patient experience. So they commissioned Explain, which are a market research company, to undertake an on-street survey across the NENC ICB area on what the patient experience was of accessing primary care. So just bear with us that this is very much indicative of trends. It's not the full story, and it's very much a point in time, because we know that since this was undertaken last summer, that local delivery teams have been undertaking a lot of work, particularly in areas, some of the areas highlighted. So we know that perhaps if we'd undertaken the survey now, that perhaps the story may be different. But this is very much a point in time. But just to say, there was a mixed response on how easy it is to get an appointment at the GP practice when asked. So 40% said very easy, and then we had 38% say difficult or very difficult. So it's very much a very mixed picture. Respondents weren't always noticing a difference in access. They were still mostly accessing general practice by telephone. They commented on reasonable call waiting times and most appointments being within 2 weeks of the same day. Only 27% of respondents that were involved in this survey used online access forms in the past 6 months, but those that had were really pleased with the process and outcome. Respondents used the NHS app for repeat prescriptions, and the majority of those that used it said it was easy to use. 77% of respondents hadn't been offered a weekend or evening appointment, and the majority of respondents in this survey weren't using pharmacy first, and with 84% saying that they hadn't used it in the past 6 months. But where they did, 76% said they were satisfied with the service and the outcome. So, with this in mind, I know that prior to the signing up to this session, some of you were asked to complete a survey about what your patient experiences of access in primary care. And so thanks so much to those of you who were able to do that. We had 14 responses from participants. And before we get into asking people to turn off the cameras and perhaps having a discussion about your patient experience, I would just like to give a little bit of feedback from what some of the people who were on the call today said about what their patient experience was, maybe to, spark some thoughts, and things that people may wish to discuss. So we had 14 responses from participants today, and 13 of you accessed primary care in the last 6 months. There was a really mixed picture in terms of how you'd access primary care. 3 accessed via an online form, 4 was through a telephone, 4 through NHS app, and 2 of you accessed in person. And the majority of you, around 10 of you, were somewhat either very satisfied, or somewhat satisfied with how quickly you could get an appointment. You talked about a quick response, quick appointment. You talked about, how online consultations were really responsive and you didn't have to keep trying on the phone. But in terms of the three of you that were dissatisfied, some of those comments came back as that they felt that someone felt that they were forced to use the app. They found it restrictive, not easy to use, particularly if they didn't have data left on their phone. Someone else said that it was somewhat the phone asking over the phone was difficult. They got told the wrong info. They were passed around. And someone else mentioned for the type of appointments that they were trying to book with a particular healthcare professional, they couldn't do it online, so they had to ring up, and they found that a little bit restrictive. So a little bit of a mixed picture, but the majority were very satisfied. The majority they didn't know or recognise the changes to accessing their practice. So that's really, really interesting. That links in with some of the thoughts that the team has about promoting the communication of the changes. And it turns out that only 4 of you had received comms about the changes to access and practices. Again, showing that, a lot of you don't know what's changed. All 13 respondents were satisfied, very satisfied with the outcome. And interestingly, there was a box at the end, which several survey, in terms of survey formats, it's quite common, asking for comments. And it's interesting because often within the field of patient experience and public involvement, the people who end up commenting either have something like a very negative experience or a really positive experience to relay. It's never anything in the middle, and this is the same here. So it's kind of like nobody ever says, "Oh yeah, it was fine." People tend to report back in detail if they've got an issue. So people said, and the 3 that reported back on this occasion said they feel like it's harder to access the services, feels like I don't have a doctor anymore. Someone else said it's just hard to make appointments. I struggle to use my phone sometimes, and don't understand the messages that come through. And then the positive comment was, I always found accessing my GP services to be a positive experience. So with this in mind, I would really like to invite everyone to turn on the cameras rather, and feedback any comments, invite any comments on your patient experience or the patients that you work with or any patient groups. Anyone? Any takers?
I would say, from my experience, it's quite mixed. From having easy access, and sometimes that's a fluke. You phone up and you get through quite quickly, or you've got a long wait before you get to talk to a receptionist. You're triaged, and again, that can be quite different from waiting for half an hour to maybe waiting 6 hours before you speak to a GP. And I'm relatively young, so it doesn't, and haven't been particularly poorly, so it hasn't been an issue. But equally, I know older people who really struggle with the system and don't always understand it, and it seems very centric to digital technology, and they're not always on board with it and don't always understand the processes and get a bit, so don't engage because they feel a bit, they don't want to bother people because that's their nature, and so step away from using the service.
Thank you. And we do recognise that, yes, like a lot of the focus is on digital solutions, and it does open up to digital issues around digital exclusion or people who don't want to use those technologies. Thank you for that. I see there's another hand up, but I can't see who it is. Do you want to just come in?
Ian, would you like to come in?
Hello, yes. Thanks for letting me engage in this conversation. I was very curious to know what the presentation was going to show, simply because I think, having listened to a lot of what was happening nationally, I was trying to reconcile the aspirations we've heard nationally with what's going on locally, and sometimes there's obviously going to be a mismatch along the way. And it did seem to me that if we're looking to do more preventative type medicine, the sort of areas that I was thinking of would be things like podiatry and dentistry and ophthalmic, things that often, if you've got an underlying health condition, they manifest themselves in eyes and in teeth and in your feet, if it's something like glaucoma, or if it's something like diabetes. And I just get a sense that so many of the appointments these days are now online, if you are lucky enough to get them. And so you're missing out on that face-to-face where preventative medicine, I think, comes to the fore. Simply because I think one person I know was asked to take a photograph of something, and if it's something that's sort of in an inaccessible place, and if you're having to use phones, it's not very easy to do that. So I think the idea was to have more of that one-to-one relationship with GPs that people used to have 30, 40 years ago, but I can't quite see that happening with the digital push that we've got at the moment.
No, that's a really interesting comment. And I wonder, whether it's a lot of it is about pressures on primary care. I mean, I invite other colleagues from the team to come in. You're very, very welcome, who would know more about this. I'm fairly new to the team, but I think, there is a big thing nationally. And I read a recent research study by the Institute for Government, and it's saying about how that patients are happier when they belong to a practice which has a smaller list size, where they can see their GP in person, where they have that, more traditional relationship. But you've got a situation, I suppose, where you've got increasing numbers of GP mergers, which leads to increasing list sizes. And I suppose that's in response to the pressures on primary care. So it's a very fine balance, isn't it? Can I invite anyone else to come in? Come in there. Has anyone else got any comments or thoughts? I can't see any hands. I'll just give you a moment. Hopefully someone may be inspired. No? Okay, that's fine. I'm going to move on to the next slide, which is talking about what we plan to do about it. So, my colleague Kerry Gamsby and I, who's on the call today, we're going to be setting up a patient experience task and finish group. And this is going to be commencing shortly, and it's to include leads from local delivery teams, involvement, communications, digital, pharmacy. And what we want to do is to consider patient experience from a wide variety of sources to understand what's going on, particularly in obviously in the NENC area. We've got a number of sources which we can look at, and we'll be looking at identifying case studies and more areas for targeted work. And some of the potential areas, which we've obviously, until the group meets, we won't know in further detail. But some of the areas we are interested in is a communications plan, potentially to promote and increase the benefits of PCARP. Excuse me. And you're looking at potentially a toolkit for general practice to explain to patients the process when they contact the practice, what happens and how their issues handled, because we feel that perhaps there's a gap there in terms particularly older patients from other groups, ethnically minoritized groups, marginalized groups may not fully understand what happens when they contact the practice, and we want to look into that and see if that's something that we could potentially support. We're also interested in looking at rerunning the Explain survey, if resources and capacity allow, in the autumn, to look at, what's been the impact, because we know that quite a lot of work's been undertaken since the last survey, and it would be lovely to measure, potentially a positive impact on patient experience. And that's everything from me. Just to say that if you're interested, there's some further resources on PCARP. This is the links to the NHS guidance, NHS England guidance rather, and some more information on the NHS app. And I'll pass back to Ashley.
Brilliant. Thank you so much, Christianne. It's great to hear the work that you guys have been doing. If anybody's got any questions, please feel free to pop them in the chat or come off mute and come in if you've got any questions for Christianne. That'd be great. We have had a comment in the chat from Tracy saying, you know, if we're becoming less reliant on face-to-face interactions, we really need to think about the language that we're using in healthcare and making sure it's real plain English to make sure that people fully understand that, which I think is a really good point there from Tracy. Definitely around health literacy.
Excellent. And also just to say, as I don't know if it's possible, Ashley, but obviously there was that pre-session survey. If people would feel more comfortable in submitting some thoughts through that survey rather than speaking today, then that'd be really, really welcomed.
Amazing.
Yeah.
Brilliant. Thanks, Christianne. Yeah, I think a link for that is on our is on the page, isn't it? But
yeah,
we can attempt to try and recirculate that for you all as well. There we go. Amy's popped it in the chat for me, just like magic.
Thank you. Thank you.
Amy. Anybody
Okay.
got any questions for Christianne? Just got the last final minute or two. Don't think so. Brilliant.
Okay.
Well, thank you ever so much, Christianne. Really do appreciate you coming along and sharing that with us. Our next Lunch and Learn is on the 21st of May at 1 o'clock. And we're going to be joined by Sam Fielding, who is the lead campaign manager at Flipping Pain. And Sam's going to share some of the award-winning approach that they have to pain science. Is going to share some of the resources that are available and share some of the findings that they've had today, and hopefully look to spark some ideas as to how Flipping Pain can better support our communities in North East and North Cumbria. So we hope to see you there. Once again, thank you so much, Christianne, and I hope everyone enjoys the rest of their afternoon. Thank you.
Thank you.
Thank you.